Are you finding it difficult in writing nursing care plan? In today's video, I'm going to show you how you are going to be a pro when writing nursing care plan. Nursing care plan is similar to nursing process. If you know nursing process, you will know this. I've already taught everything you need to know about nursing diagnosis, in-depth explanation of nursing diagnosis. But for the sake of this class, I will be touching it peripherally, the little things you need to know because it is actually one of the components of this nursing care plan. If you know nursing process, this nursing care plan is just easy. It will be easy for you. You get so let's get into the business. Nursing care plan is a structured approach to providing individualized patient care. It helps nurses systematically assess, diagnose, plan, implement, and evaluate care. It's still the same thing with nursing process. It follows step by step. It's done by patients. So the steps now under this nursing care plan are nursing diagnosis. We have nursing diagnosis, nursing objective, nursing intervention or action, scientific rationale, evaluation, and when drawing it, when plotting it, you will now see serial number and signature. So the first thing now, before you will enter this nursing diagnosis, you have to assess the patient. So assessment now comes in. In assessment, we have subjective data and objective data. Subjective data are patient verbal reports. If you meet the patient tells you that I'm feeling pain, the body is itching me. This is patient verbal reports, which are subjective data. Objective data are the one you measure yourself, the nurse or the lab technician. In here now we have your vital signs and your lab tests. And you also identify patient risk and patient needs. So with these three now, you now form the nursing diagnosis based on the assessments, based on what you've assessed, based on the collection of subjective data, objective data, the patient's risk and patient need. You will now form your nursing diagnosis. And we now say that nursing diagnosis now, it identify actual or potential health problem of your patient based on assessment. Maybe this patient now has pain. From what the patient told you, from your nursing diagnosis, like you can actually back it up with pain scale. You ask your patient from 1 to 10, how severe or how moderate is your pain? The patient says it's 8. You now know that the pain is severe. So your nursing diagnosis can now be acute pain. So that is how the nursing diagnosis is being formed by using patient assessment. We have other types of nursing diagnosis. We are going to only touch two, which are actual nursing diagnosis and risk nursing diagnosis. Actual nursing diagnosis consists of 4 components, which are label, human response, related factor, characteristics, which is also known as signs and symptoms. So the label now is just like adjective that describes or qualifies the human response. This human response can also be known as the focus. Related factor now is the cause, the causative factor. Why the characteristics now is the signs and symptoms. We told you that this actual problem is what the patient is manifesting, the present patient needs or patient response, because the signs and symptoms are already manifesting. So it is actual nursing diagnosis. Why risk nursing diagnosis? It is yet to happen. With the prompt and quick intervention of the nurse, the risk diagnosis can be prevented. It has no characteristic, no signs and symptoms because it is yet to happen. Example of actual nursing diagnosis is we have imbalanced nutrition, less than body requirements, related to reduced dietary intake, evidenced by weight loss. So the label now is imbalance. The label is imbalance. The human response now or focus is the nutrition. The related factor is reduced dietary intake. Why the characteristics now, which is the signs and symptoms, is weight loss. Come to risk nursing diagnosis. Example of risk nursing diagnosis is risk for infection related to catheterization. That it has no signs and symptoms because it is yet to happen. So the label now is risk. The human response now is infection. The related factor is catheterization. The step now, we have already done this nursing diagnosis. So we are to enter nursing objective. What is nursing objective?